Coming to EMG, which is electromyography, here there are two types. They are going to measure the movement of the muscle and its electrical impulses. So there are two types here as an needle electromyography. Here they are going to place a needle into the musculature and thereby they are going to record the muscular activity. So this can be done either towards the one extremity or to the muscles in bilateral extremities or in the upper and lower extremities. Accordingly, you have to select the codes. You can also measure this EMG by way of this hemidiaphragm or larynx and all the other structures as well. Needle EMG can be reported either as a standalone procedure or in conjunction with nerve conduction studies. So a patient who is presenting with neuropathy or any disturbances of the nervous system like paralysis or paresis, now the neurologist is going to order for a nerve conduction study. So nerve conduction studies, basically we have three tests. So one is, we have written that as SMH. S means a sensory, M is a motor and H is a H reflex or a Hoffman reaction. So a Hoffman reaction occurs after stimulation of a sensory nerve. We have an F wave, which is a kind of a motor reaction or it is a late reaction of the muscle. Okay, so coming to the coding of these types of conduction, you need to consider only the number of sensory studies, the motor studies and the H reflex studies, because you are not supposed to count the F wave, because this F wave is bundled into the motor study. In case if a motor study is not documented but only sensory and motor or sensory and H reflex and F wave, then this becomes a triple study. So you can easily figure out the number of studies. It's not the number of nerves that are being studied. Take for instance, now the physician is going to study the sensory nerve study and the F wave study of the femoral nerve. Then you need to report it as two studies, because the nerve is just one, but the study that is being reported as a sensory and an F wave. Perhaps if sensory, motor and H reflex is also a study, we can report that as three conduction studies. If bilaterally, if this being done, then you can report it as 6 conduction studies. Okay, sometimes needle EMG might be done along with SMH. Okay, in that case, the needle EMG becomes an add-on code. Nerve conduction studies become the primary code and the NCS is always primary and needle EMG becomes secondary. You should also know whether this EMG is going to be of a limited study or a complete study. If less than 5 muscles are studied, that becomes a limited study. If more than 5 muscles are being studied, then we can take that as a complete needle electromyography.